Well, hi there, everyone. This is Susan Snelling coming to you. I am a Senior Knowledge Translation Specialist at the National Collaborating Center for Methods and Tools. And it's a real pleasure to be with you today for this webinar. We did one webinar last night and had a really good crowd and some good questions and comments. So hopefully we have another good session today. So we have a virtual panel of students and recent students lined up to share their experiences and recommendations for methods and tools that support evidence-informed decision-making in public health. So I'm really excited about this. We'll get right to it. Glad you could join us. Just a word about our process here. So we will be using chat along the right side if you want to send any comments or questions during the webinar. We really encourage your comments as we're going along, and encourage you to send your comments through chat to all participants so that other people can see your comments and questions too. Hopefully the audio is good now. I was a little bit delayed because my phone went dead, but I think I'm back now, so hopefully that's good, and we won't have any further issues. So maybe you can actually try the chat now just to be sure that you're connected, and make a little post in chat to let us know where you're calling from. If you are a student, as many of you are, maybe you can tell us what program you're in as well. So we'll just watch those coming in. Happy to welcome everybody from wherever you're calling from. Oh, Victoria, BC, nice. I think you're going to win the prize for the farthest away from me. I'm in Ontario, but who knows? We might get people from even farther than that. Welcome to you. Bonjour à tous. Oh, all coming in. That's fantastic. Thank you. Oh, public health at the University of Brazil. Sorry, Victoria. You just lost the prize. Welcome to everyone. That's fantastic to see all these numbers coming in. So we're going to be talking about a lot of resources that we're hoping you will be interested in following up on after this event. So we will be posting those links alongside in chat, as you can see is happening right now. But if you want to get the full set of slides with all the links in there, you'll be able to do that on our website, which is nccmt.ca under previous webinars. And also there will be the audio recording of the actual session. So if you want to go back and revisit some of the discussion about the resources, what each of them might be used for, the audio will be there as well. So we encourage you to make use of that after today. Our intent for the day is I'll give a little bit of introduction to the National Collaborating Center for Methods and Tools, and in fact to the other NCCs or National Collaborating Centers. I'll talk a little bit about evidence-informed decision-making and evidence-informed public health, what we really mean by those terms, just to set the context. And then the bulk of our agenda is focused on hearing from students and some of the resources that they suggest are good for supporting evidence-informed practice. We do a fair number of these webinars at NCCMT, just guiding people through resources that would be most relevant for the kind of practice that they do. And certainly for this one, intended to be for graduate students, we thought, well, let's go right to the source and have you hear from graduate students and people who have recently been graduate students in public health, and hear from them what they have found most useful, and maybe some resources that they wish they had known about if while they were doing their studies. So really looking forward to hearing from the students, and I'll introduce those folks in a minute. And we will have some time at the end for question and answer discussion, any comments that you want to bring forward. But as I said, you're welcome to comment and ask questions at any time using the chat function. After the webinar, we're hoping that you will be familiar with the key features of a model for evidence-informed decision-making and the process for evidence-informed public health. Know where to access these tools that students have found helpful to get you to the best available research evidence in decision-making. And understand the perspectives of other graduate students on what they have used, what they found helpful, and a little bit more about their context and the work that they are doing. So we will have a couple of polls here just to get a sense of who's on the call. So first of all, the question, what is your role? So you can see that on the right. You will have to hit submit at the bottom once you're finished putting your entry in. So just as the numbers are coming in, I'm seeing that most of you are graduate students, which is fantastic. That really is our probably target audience for this session. Some in other roles, a few undergraduate students and faculty. So welcome to you all. I think we will have something for everyone. So I'll just give another minute or so. And yes, the preponderance are graduate students for sure. So we welcome you and everyone on the call today. A little bit now about the National Collaborating Centers. So there are 6 of them across the province. So as the name implies, they are national in scope. Some focus on topic areas in public health, and others cut across many areas, like ours at the National Collaborating Center for Methods and Tools. Those are methods and tools for evidence-informed public health. So if we wanted a longer name, that would be it, but we feel like Methods and Tools, or MT, is quite long enough. So the NCCs, moving from west to east, there's the NCC for Aboriginal Health in Prince George, the National Collaborating Center for Environmental Health in Vancouver, the NCC for Infectious Diseases in Winnipeg, NCC for Methods and Tools, that's us, based at McMaster University in Hamilton, the NCC for Healthy Public Policy in Montreal, and the NCC for Determinants of Health in Antigonish. So although the NCCs are based across the country, they do, as I say, have a scope that's national, and all of these NCCs focus on the needs of public health professionals. That really was the intent when the National Collaborating Centers were set up, is to support people working in the field of public health. And that still, of course, involves a wide variety of professionals and different roles, but the focus really is on supporting people who are currently working in the field. Now, for most of you as students, that may or may not be the case for you now. Some of you, I'm sure, are already working in public health, and some of you perhaps just have intentions of working in public health. So we encourage and welcome students who are prospective public health professionals to become familiar with all that the NCCs have to offer. So a little bit of terminology then. A definition of evidence-informed public health is on the screen here. So we're talking about the process of distilling and disseminating the best available evidence from research, context, and experience, and using that evidence to inform and improve public health practice and policy. And those are lots of words, lots of content there. Put more simply, we mean finding and using and sharing what works in public health. And I will draw your attention to the fact that we're talking about the best available evidence from research as well as from other sources. And so sometimes the best available has limitations to it. So we're not about focusing on the perfect, the gold standard, only the top of the line evidence. We want good quality evidence, but we recognize that to be practical, we need to focus on what's available. So how can we find the best available and work with that, acknowledging those limitations? Evidence-informed decision-making, which is a related concept to evidence-informed public health, evidence-informed decision-making is the process by which we can support and arrive at evidence-informed public health, where we're actually getting to put all this into practice. So we want to be using evidence in our decisions in order to get to evidence-informed public health. So that's some of the key terminology here. And another kind of piece of terminology or conceptual material that I want to just introduce early on is this model for evidence-informed decision-making in public health. So in looking at this model, which may be familiar to some of you, when in public health we're deciding what interventions to implement, like what should we actually do to deliver public health programs and services and policies, we want to consider all the evidence that we have available to us. And so this model kind of breaks apart those different kinds of evidence so that we can be clear about what evidence may be influencing our decision. So starting at the bottom left, certainly research evidence we would want to come into any kind of decision that is based on evidence. But there are other things too. So community health issues and local context. Sometimes we may find a really effective intervention in the research evidence, but that particular issue is not a big problem in one community. And so there would be no reason to implement an intervention if that health issue isn't really a concern in that area or for that local setting. In other local settings, it may be a big concern, and therefore we would want to think more seriously about implementing an intervention. So community health issues and local context need to be considered as well when we're making decisions about what to do. Community and political preferences and actions. So what will people accept? What will people tolerate? Is there readiness for a particular action? You can probably think of public health actions that are not politically popular, maybe have some pushback from the community. So what we're saying here is not that, oh, if somebody in the community doesn't like it, then we won't do it. It's more nuanced than that, but certainly we want to be thinking about what the community will support and what's interesting to them. There's not much value in putting together an intervention that no one wants to be part of. So we need to take that into account for our decision-making as well. Political preferences, same thing. It's not that we just say, okay, well, you're not interested, never mind. Sometimes we need to have that dialogue and bring partners into that decision-making. Public health resources, whether that's time, money, skilled people, all of those things determine whether and to what extent we'll offer a certain intervention. Could be the best intervention in the world, and if you can't afford to do it, then that would influence the ultimate decision that you would come up with as well. And then all of this together needs to be considered with a view to our public health experience and expertise. What have we already done? What do we have in place already? What are our partners doing in the community? what do we feel would be most effective, or is there a staged approach that we need to do? So we're not approaching this as robots that just do exactly what the research tells us. We're taking a much more broad and informed approach to using evidence in our decision making that includes our experience and expertise in public health. So all of these sources of evidence become important when we are making decisions. And you'll see that many of the resources that we're going to be talking about really are guiding us toward using one or more of these sources of evidence in an effective way to be able to make good, solid decisions that we can rationalize and stand behind. So thinking about all of these sources of evidence, I have a question for you. Just from your observation about public health, which of these factors has the greatest influence on decisions about public health programs? I'll just give a minute to hear some of your, see some of your perspectives on that. So I would say so far, just as these are coming in, the big winner is resources, a big determinant for sure. And, I would say particularly as public health units, departments, health authorities are grappling with financial constraints, there really do need to be choices made about what we do. If we do one thing, we can't do something else. And so resources absolutely are part of that decision making. What we would want to see for sure is that if we are having to make those tough choices about what to do and what not to do, we would also want to see research evidence be considered as part of the determining factor about what we do. If we're going to make a choice, let's at least choose to do something that works or has been proven to work in other contexts. So others of you are seeing that community health issues are important, community and political preferences. Well, for sure, and I think we can stop the polling now. And just to say there's no right answer to this question, and it varies depending on the issue. Sometimes it's the resource constraints that have the greatest influences on our decisions. Other times the research evidence really rises to the fore and people are saying, look, we have to do this. The evidence is really compelling. Other times a community health issue really rises to the top and people are saying, let's get on it. This is too important not to be doing something that will respond to this issue. The ideal thing, of course, would be to have a mix of all of these, and certainly from our perspective, we would want to see research evidence being part of that process of making the decision. Now, one other little bit of terminology about using the term evidence-informed. You may have heard the term evidence-based medicine. In public health, we tend not to say so much evidence-based. We're more likely to use the term evidence-informed. And the reason for that is that we know that these contextual and local factors do and should come into our decision-making. So we're not only going to base our decisions on research evidence. That probably wouldn't be practical and wouldn't be respectful of communities. So we're evidence-informed, meaning that the evidence, the research evidence comes into part of the consideration of what we do, but certainly these other things are present and important influences as well. So that's kind of the background, the context setting. I want to now get to the main portion of our session, which is to hear from one current MPH student and a couple of recent grads. We asked them 2 questions to think about, and we'll go through these in turn. The first one of those is, how are evidence-informed decision-making skills important in your studies and or in your work in the public health field? And secondly, what's an evidence-informed decision-making resource that you have found useful? And I'm quite sure that you will be interested to hear what they have to say about both of these. So our presenters today, I'll ask them to introduce themselves, and we certainly thank them for being willing to take the time to share their perspectives with us today. So Alana, do you want to introduce yourself?
Yeah, sure. Hi, my name is Alana Chu, and I'm currently a second-year Master's of Public Health Epidemiology student at the Delawana School of Public Health at University of Toronto. And I just finished my practicum at Public Health Ontario in the Health Promotion, Chronic Disease, and Injury Prevention Department. And my research interests are sort of twofold. I have one hand in injury prevention and the other hand in mental health. And I'm really happy to be talking to you guys today.
Fantastic. Thank you, Alana. Lena, would you introduce yourself, please?
Hi, guys. I'm Lena Shirazi. I did my Master's in Public Health at Western University in London, Ontario. And right now I'm working as a health promoter at the Region of Peel, a local health unit for those who are outside of Ontario. And I've had some experience working as a research assistant at the National Collaborating Center for Methods and Tools. It's great to be here with you guys.
Excellent. Thank you so much, Lena. And Hannah, over to you.
Hi, everyone. My name is Hannah. I graduated from my Master of Public Health at the Delawana School of Public Health at U of T in the spring of this year. And I did 2 practica during my Master of Public Health. One was at the National Collaborating Center for Methods and Tools, and my second practicum was at the Center for Global Child Health in the Kids Hospital. And I am currently working there, but I'm also spending some time also working as a research assistant with the National Collaborating Center of Methods and Tools. And my areas of interest include global health, evidence-informed public health, and I'm working on developing my quantitative data analysis skills. So I'm happy to be here with you today.
Great. Well, thank you so much. Thanks to all of you. So we're going to get to the first question that we posed to each of these presenters, which is just to talk about how evidence-informed decision-making skills have been important in your studies and in the work that you've done or are doing in the public health field. So I'm actually going to go back to the photos so that you can see who's speaking, and I'll ask Alana to address that question first.
Sure. So as I mentioned, I'm currently a student in epidemiology. And in epidemiology, there's a big focus on reviewing and producing research evidence, so that bottom left purple bubble in the model. But EIDM skills still play a really big role in what I do because it determines what and how and when we in epidemiology conduct research. So they're still very important in my studies, in my practicum, and in my work. So EIDM skills are really essential in all aspects of conducting research, including epidemiological research. They are needed when you form research questions, when you make sure that you're looking in the correct places for all the best available evidence, and being able to understand and synthesize the research that you read. It's necessary to use the best evidence available to inform your research direction as well. So we need to assess evidence for quality and make sure that your research is heading in the right direction. But it's also important when you decide what sources that you can draw from. Another thing that I think is really important about EIDM skills that are often overlooked in research is that research needs to inform practice, but practice also needs to inform research. So you have to make sure that when you're, what you're studying actually makes sense in the population, and the recommendations that you produce from your research make sense within the current practice. So I'll give you an example of my practicum at Public Health, Ontario, where I conducted a study on off-road vehicle injuries. Those are like ATVs and snowmobiles. It was important to use EIDM skills to determine what the best evidence was saying about off-road vehicle injuries globally and locally, and using the information to determine a good, solid research question, but then also understanding what's happening in terms of motor vehicle injury prevention practice in Ontario and what would actually work in Ontario. So using this evidence from both research and practice, we can make decisions about recommendations that are appropriate and achievable in our context. So I would say that my main takeaway is that even on the EPI side of things, EIDM skills are really essential to being able to understand the context and the policies to conduct relevant and useful research.
Great, thank you, Elena. It's lots of important concepts there, and you know, certainly one thing that you said that really strikes me is about the practice informing research as well. We really want to be kind of having that dialogue between what people are noticing and learning in their practice, and really making that use of evidence relevant in the field. So thank you for that introduction. Hannah, I'll go to, let's mix it up, we'll go across. Lena, would you introduce yourself, please? Thank you.
Hi, so for me, using evidence-informed decision-making was really important in my MPH program, but as well as work. So during my studies, it was very useful doing the research piece of EIDM. So there were a lot of literature reviews that I had to do in my studies and writing papers, of course. So the skills that I used from EIDM was defining the research question and having a solid search strategy so that I can get the information I need and write my reports. But these skills became even more useful during work. So as my experience in public health as a health promoter, I have to be super efficient when I'm searching for evidence. So it's important, again, to have that defined research question using whatever method that you want to use. So the common one is PICO that I still use in my work, and searching for the highest level of evidence first, so something that has your synthesized information, so starting to look at guidelines and then systematic reviews. Also, skills that have been super helpful at work is the critical appraisal skills. And it's really valuable because when you're on the job, you need to justify the decisions you're making, and the decisions that you're making they impact a lot. So you have your funding, and you're serving a population at a local health unit, so your overall population, and your resources. So it's really important that you are accountable and having solid research and critically appraising that research so that it is high quality is a big piece. As an example of how I've used EIDM, I'm under the Chronic Disease and Injury Prevention division, and my team is focused on physical activity. So something we've been working on right now is putting together a strategic plan to guide our work in the future. And the first step that we took was actually looking at the evidence. What does the research say? So we looked up interventions on physical activity, so using that research piece of EIDM. But through the process, the other factors of EIDM really stood out. So like knowing your local context and having know what your public health resources are to make those future plans. So when we're planning programs, we have to look at the data. What's our priority population in our local region? What's acceptable for them as an intervention? And then what's our capacity? Do we have the funding to do what the research says is most effective, and do we have the staff time to do it? So that's been my experience with EIDM and how it's important both in my schooling and on the job.
Great, thank you. That's really helpful. And one of the things that you mentioned, Lena, is that need to be efficient And I just wanted to comment on that because, as I said, what we focus on at the National Collaborating Center for Methods and Tools is the needs of public health professionals, people actually working in the field. And so along with that, we really emphasize that need for efficiency. We know that finding and using evidence is probably not the only thing that public health professionals have to do in their jobs. People do many things, and sometimes evidence is only a very, very small part of what they need to do as part of their responsibilities. So the methods and tools that we focus on for evidence-informed decision-making are designed with efficiency in mind. How can you do a good, thorough job while still getting to that decision and the evidence that supports it in a timely fashion? So you'll see that a lot of our methods and tools that we promote and that we'll talk about in this webinar are designed to help you do things quickly, help you not waste time, help you sort through what needs to be done and leave aside those things that might be nice to do but don't necessarily have to be done. So that point of being efficient is something that you'll really see cutting through what we do at NCCMT. So thanks for raising that point, among others. And then, Hannah, would you talk about how EIDM skills have been important in your studies and your work?
Sure, yeah. So EIDM skills have been important for both my schooling and for work. In my MPH, we had several classes that required critical appraisal of the evidence. So that was like health promotion classes, but also quantitative and qualitative research methods courses. So it was very helpful to be able to search for the evidence that we needed for our projects, but also to critically appraise them and look at the different tools. So I'll be talking about the Registry of Methods and Tools later on, and that really came in handy for this in order to find the tools that you can use to critically appraise the evidence that you're using in order to be able to decide which evidence is more reliable. And in school, I also found that in every project and paper, we needed to make sure that we were considering all of the available evidence and the quality of that evidence. And like Susan was saying at the beginning, it was interesting to me to consider what we can do when there is no gold standard evidence, so when there is no randomized control trial or meta-analysis, and what do you do in that situation? And there, with evidence-informed decision-making, you really just use the best available evidence that you have, and that you understand that evidence does inform decision-making, but there are other considerations that exist too, and there are consequences on waiting for the perfect evidence. So sometimes there is a big need, and it needs to be addressed right away, and you can't wait for the perfect evidence to exist. And at work, I found EIDM skills were just as important, if not more so. I have worked on a systematic review here at the Center for Global Child Health, and it requires systematically searching for the evidence, and it also requires critical appraisal of evidence, and a really clear search strategy, which is another thing that you can find tools for in the Registry of Methods and Tools. And when doing research for my work, you have to really consider how it will be useful and to whom you can present the evidence. And for me, that really brings up the concept of partnerships and knowledge translation. So who are the partners that you'll be sharing your research with, and how are you going to be translating that knowledge? And you're really looking at the end users. So if they are engaging in evidence-informed decision-making and you're providing them with the evidence, how can you make it so that it is as helpful as it can be? And I know from my work at the Center for Global Child Health, there are partnerships with ministries of health around the world. And in this way, researchers can really ensure that their research is seen by the decision makers, and these decision makers will be likely using evidence-informed decision making in the decisions that they'll be using for policies, and that's really something that needs to be kept in mind when conducting research as well. So that would be my take on how EIDM skills have been important for me thus far.
Great, thank you for that. Lots of important concepts there as well as we start to think about what does it really mean to make decisions in an evidence-informed way. One of the concepts that you mentioned, Hannah, is that often it's not a perfect world. We won't always have the perfect evidence that answers every question that we have. And because we're in practice as public health professionals, we still need to move on. So what do we do in that less than perfect situation? You will see some tools that can help to navigate that a little bit, whether it's just appraising the evidence so that you know how good it is and where there are some limitations, but also being able to pull that together in an effective way that doesn't overstate the strength of the evidence, but still draws on the best available evidence. So a really important piece of thinking about evidence-informed decision-making, and that need to communicate with different audiences. So who's actually making the decision? Who's doing the research? Who needs to implement this program? All of these are factors in communicating about evidence, and it's a really important piece of any kind of knowledge translation approach, which really is the field that we are working in, is how do we take research evidence and move that knowledge into practice. We need to include the partners as well, who are important in various aspects of finding and using evidence. So thank you to all those presenters for that discussion of what you've found helpful to date. And we'll move then to the next question that we had for our panelists, which is about resources that you have found useful. And I'm actually going to kick this off just to talk about one of the really key resources that we have at the National Collaborating Center for Methods and Tools. We call this the wheel, and it is a process that describes the stages of evidence-informed public health. It is a circle, it's a wheel, so it doesn't really have a start and end point. However, we tend to start talking about it right at the top, at the define stage. So if you're going to do evidence-informed public health, you first need to define the question. What is it that you really would find helpful to know? Where are you going to search? How do you search systematically for evidence that will help to answer your question? How can you critically appraise that evidence? And it depends on the type of evidence that you're finding. How do you synthesize? You'll have different evidence coming from different sources. Maybe they even conflict a little bit in terms of what they have to say. So how do you synthesize and bring all of the research and evidence together? How do you adapt it to the local context? What works in one place maybe won't work in another. So you need to consider that as well, and we have some systematic ways of doing that. How do you get to actually implementing? How do you make those changes from what you were doing to what you're going to be doing based on what the evidence suggests to you? And then evaluating. Is it working? How do we know that it's working in the local context? And once you check in on that evaluation, usually you have some more questions, which takes you back to define, and the process starts again. So you will see, if you explore the website for NCCMT, that most of our resources are organized around these different stages in the wheel. So you'll find some resources that will help you with defining your question. You'll find some resources that help you with critical appraisal. You'll find resources that help to adapt to local context, and so on. All of these stages are represented. When the NCCMT got started more than 10 years ago, knowledge translation and evidence-informed decision-making were still kind of new concepts for many people working in public health. And so a lot of the need at that time was just to be able to know where there were tools and checklists and frameworks, methods to help people do these steps. So what we did early on at NCCMT was just to pull together what was already in existence that would help people to do these tasks. Remember, one of our key areas of focus is for public health professionals to be efficient in what they're doing. So if someone has already worked out a process, figured out a checklist for doing something, that can save you time. And so that's completely up our alley in terms of helping you to be efficient. Some of the methods and tools that we have on the website are ones that we've developed ourselves at NCCMT or have been developed by Health Evidence, which you'll hear more about, but is kind of a sister organization to NCCMT. And some of the resources have come from elsewhere around the world, different people, researchers, organizations working also on evidence-informed decision-making. So we have resources from lots of sources, all related to building capacity to find and use evidence. So lots more to explore around this model if you check out our website. Now, as you're starting to explore what we have on our website and you're looking for methods and tools, there's a registry, which we already mentioned a little bit, but this is one that I think Hannah wanted to comment on, so I'll just turn over to Hannah to talk about the Registry of Methods and Tools.
Hi, yes. So the Registry of Methods and Tools is it is a searchable database which includes methods and tools for knowledge translation, and it can be found on the NCCMT website under Knowledge Repositories. I've actually, when I was working at NCCMT for my first practicum, I actually did write some of the summaries for the registry. So I am quite familiar with both sides of both using the registry and also working on the back end of the registry. So methods and tools for the registry are identified in many ways. Some of them are actually designed by NCCMT, but many of them were identified through conferences, presentations, newsletters, and networking. And they do have specific inclusion criteria, so they need to be relevant for public health practitioners, and every summary includes how specifically that method or tool is relevant to public health practitioners, so we identify that. And it also needs to be relevant for knowledge translation. And it's I found that the registry has been very useful because it provides one specific place where you can find a wealth of information about methods and tools to be used in knowledge translation for public health. And I personally have found it specifically important when looking for tools to appraise evidence. So I found that I used that in school and also at work to find tools to appraise specific types of evidence. And I also think that it's very useful for building skills. So there are several methods and tools that actually, the entries actually have courses, so online courses that are offered by different organizations. And it's really helpful to build specific skills that you're looking for. I actually used the Registry of Methods and Tools doing a school project specifically in epidemiology and in qualitative research methods, where we need to present, we needed to pick an article and present which appraisal tool we chose and how exactly we scored it, and then we discussed with the rest of the class how they might score it. And I found that that was really helpful, and the way that I identified the specific tool that I used was actually through the Registry of Methods and Tools. So I find it's quite helpful, and I think it will continue to be helpful in my career because there are so many good methods and tools on there, and it's easily searchable. So I find that it will continue to be helpful, not just in school, but also during my work as well.
Great. Thank you, Hannah. Certainly lots there to explore in the registry. So thanks for bringing that to our attention. And you'll see both in the side panel in chat as well as just at the bottom of the slide, the registry can be found under Knowledge Repositories on the NCCMT webpage. So the next resource that really can help you to navigate and build your knowledge related to any and all of those steps on the wheel, and you can see it here on this slide as well, is online learning modules that are available through the website. So if for those people who were on this same webinar last night, so we're kind of doing a reprise today. Last night we had another student who was talking about this, but Grace is not available today. Why? Because she's working in public health and wasn't able to join us during the daytime. So I'll actually talk about this online learning collection of modules, but rest assured it did come through as a suggestion from a recent student. So what you'll find in the Learning Center at the NCCMT, so it's accessible through the website like the other resources that we're talking about, are modules that they're free. They're accessible from wherever you are, and they focus on the different aspects, so defining, searching, everything around that wheel, so different stages in the process of evidence-informed public health. So these modules take 2 hours, sometimes a little more than that. They're self-paced, so you can go through as quickly or as slowly as you want to. Sometimes people have done these in groups or teams in their workplaces, for example. When you complete, there's a little multiple choice test, not to scare you, but there is that checking in, and if you get a certain level of success, you get a certificate, which can be helpful for professional development kinds of things, to demonstrate to prospective employers that you are taking an interest in lifelong learning and building your skills. I know for some people, they show up in a new job or a new role, and all of a sudden people are saying, oh, yes, we're expecting you to be able to do this and that. And, maybe it's something you haven't had a lot of experience with. By just spending a couple hours doing this module in a particular area, you may be able to build some comfort with what needs to happen and what the skills are that your employer may be looking to you for. So the kinds of topics that are covered in each in a separate module, there's one about just introduction to evidence-informed decision-making, one about research designs, one that supports you in how to do a good search for evidence. And again, if you've ever done a search for evidence, which I'm sure all of you have, you can spend a long time doing that and sometimes not have much to show for it at the end. So knowing how to do a good and efficient search really will stand you in good stead. So this module can help you with that. Critical appraisal, there are different modules for different kinds of evidence that you may need to appraise the quality of. So systematic reviews, qualitative studies, intervention studies. There's a module about adaptability. There's one about organizational change, which as we start to implement our decisions, really what that is a change within our practice or within our organization. So it's important from an evidence-informed decision-making point of view to also understand the process of supporting an organization as change is happening. So all that and lots more too can be found in these modules. If you're not quite sure where to start, you'll see showing on this slide that there's an online EIDM skills assessment. So a collection of multiple choice questions that will give you kind of a tailored answer, tailored feedback about where your skills are strong and where you could still benefit from building some additional knowledge. So by doing that skills assessment, you can help yourself to focus on those areas that perhaps are most worthy of your time and will be the best investment. So I encourage you to take a look at that online learning. You will need to sign in and create an account. It's free. It doesn't mean that you're going to get a lot of email and spam, none of that. The reason we get you to sign in is so that you can have a record of what modules you've completed, which ones you hadn't, so that you can start and stop. So if you want to do 10 minutes on a module and come back tomorrow, the system will remember where you were and just start you at the right place. So that's the reason for the login if you want to get started with the online learning in the Learning Center. Now, I'll just go back one second. So making reference again to the wheel, we'll start now to think about resources that may help you to do particular steps on the wheel. And if you're thinking about the, if you're thinking about the define step, having some framework to help you to define your question is something that we have resources that can help you with. And so I'll ask Alana to talk about some of those resources.
Thanks, Susan. Yeah, I really wanted to talk about finding good evidence, which Susan just mentioned is really, really important in the research process. And of course, it comes with a lot of parts like finding a database or finding great literature, which can be very difficult. But I really wanted to focus on search strategy frameworks. So I'm sure everyone on this webinar has used a PICO before. And it's true that the PICOs are kind of the classic go-to. And if you don't know what a PICO stands for, it stands for Population, Intervention, Control, and Outcome. And we use this PICO framework to develop a good search question or strategy by defining what you're looking for in each of these categories and then finding keywords and mesh terms that you can use later to conduct a library search. But I think something that's really important is to go outside of the PICO boxes if the PICO doesn't fully capture all the concepts, which it doesn't in all cases. So this is something I sort of learned later after quite a bit of frustration, and it's that you really shouldn't stuff your search into a PICO if it doesn't work, because there's so many other frameworks like a Pisco or CocoaPop or Spider or Spice and a bunch more. And so if you look on this slide, there's a list of just some of the frameworks that are developed by a number of different authors. The paper is by Davies in 2011, and it provides great examples. The citation is at the bottom, and I think it's a really great paper because I actually found it super difficult to find these frameworks myself. And, you know, it's good to have a good starting place. And you can see from this, the different frameworks work better for different types of studies and different topics. So, for example, in my practicum at PHO for the off-road vehicle injuries, The purpose was to really describe what was happening in Ontario. And it had really nothing to do with an intervention. So you can see that a PICO wouldn't really make sense. So in this case, I went through a number of different options, and I came up with the best being a COCO-POP, which is condition, context, and population. So you can see this is way better for studies where you're looking at surveillance or you're looking at the prevalence or incidence in a population. So I would really stress the importance of using a framework to scope out your research question and making sure that you explore more options than just the PICO. If you want another good resource, the NCCMT's Registry, which Susan was just talking about, is a great guide for using, they have great guides for using the PICO, the spider, and the spice. So that's available online.
Great. Thank you, Alana. And, you know, certainly a lot of the training and capacity building work that we do at NCCMT really starts at this point by helping people to be clear about what it is they're actually looking for when they go to the evidence and being systematic about that. So having a framework, whether it's PICO or something else that fits better, doesn't matter so much which one it is, but to have a framework, to have a structure, really is a critical place to start. So lots of frameworks out there, and it's good to know what your options are here. So thank you for that. Now, as you define your question using PICO or Spider or some other alphabet soup, you then will want to start searching. Well, where do you search? So the pyramid that's shown here is something that can help you with that search, being efficient and being systematic with it. So I'll ask Lena to talk about this in more detail.
Yeah, so this is definitely a helpful resource from NCCMT to help with your search. It's a success pyramid showing you where to look for the highest synthesized evidence and usually the highest quality evidence. So you start with your systems at the top, summaries, synopses, syntheses, and so on to primary evidence. And you can see on the slide here there's a line that's with the orange box showing you that anything under that might have resources that you need to critically appraise yourself. So this tool on NCCMT is not only just to show you where to start looking for evidence, but also links you to different search engines and databases that are helpful for looking for that evidence. So right now on the slide, the one that's highlighted, you can click through each of these when you're on the website. The syntheses one is for systematic reviews. So we have health evidence, which will be talked about later on, is a registry for systematic reviews, and they are critically appraised. And then you also have Public Health Plus, which includes systematic reviews and some primary research as well. So it's really helpful in that once you have your search strategy, you want to look for that high quality evidence and guides you through the process till you find what you need.
Yeah, fantastic. Thank you. So the success pyramid is a really foundational structure that can be helpful in trying to navigate where do I look, what kind of evidence should I be focusing on, and again, getting at that efficiency priority of not looking at everything, but being systematic about where you look and what you're looking for. So different levels of synthesized evidence, really important. So we've mentioned health evidence a couple of times, and so one of the good resources, good databases for looking for evidence is, in fact, health evidence. It's a sister organization to NCCMT, as I said, and so I will ask Hannah to talk about health evidence in more detail.
Sure. So every month, a search is done for the newest evidence that is going to be included into the health evidence database. And after that, a relevance screen is done. So all of the included reviews need to be relevant to public health practitioners. And after that, the relevant articles are appraised and rated. So there is a quality assessment provided. So the rating is up until 10, and 10 is the strongest rating. And the quality assessment that's provided online actually tells you how each of the reviews has been scored for each of those 10 questions. So it's very helpful to be able to see where it's strong in and where it might be weaker in. So it's a registry of reviews. So these are all, they're not individual articles, but they are reviews. So systematic reviews and meta-analyses. And it's very easy to search. And with the advanced search function, you can actually do an advanced search because each of the articles is tagged with various topics or populations. So if you have a specific PICO, so you can look at the population, you can look at a specific intervention, and so on. So it's pretty user-friendly, and I know that I used it in my first and second year of my MPH. The quality assessments were very helpful. Actually, we had a specific assignment that was designed around providing evidence on a specific health promotion strategy, and we needed to do a search and find the available evidence, appraise that evidence, and then provide a suggestion as to how to proceed. So it needed to be evidence-informed. And I also think that health evidence is very, very useful for people who are in the field of public health program design, because when designing a program, you want to see what's been done before, in what different contexts, for which different populations, and what's worked before. And searching health evidence is quite easy and also useful to be able to find past evidence on what has worked with a specific disease or with a specific condition that you're trying to tackle, and what interventions have worked in which populations and age groups and that. So I think that even though I have not had the opportunity to use in public health program design, I think health evidence would be very useful for that as well.
Yeah, thank you so much, Hannah. Health evidence, I would say, is a great resource. If you don't know about it, you probably would benefit from becoming familiar with it. You know, for me, if someone asks me, you know, what do we know about a topic, is there anything out there, health evidence is often the first place that I go. It may not be the only place that I go, but because it's filtered to only include content that's related to public health and relevant there, it really helps to hone in on the things that are going to be most useful to know about. So thank you for describing that one. Now, of course, health evidence is not the only database out there. There are lots of them. And another one that, again, I'll just go back to the pyramid, you'll see at the bottom of this slide it also talks about the TRIP database as another source, and Lena is going to talk a little bit more about the TRIP database.
Yes, so the TRIP database is also a helpful resource when searching. It's mostly clinical, but does have resources for public health and health-related information. So what I really like about it is it gives you the option to search in using your PICO. So you can put in what your population, intervention, comparison, and outcome are in the search bar. And the way it displays the results are kind of like the success pyramid. So it starts with that highly synthesized results, like guidelines, and it actually outlines where the guidelines are from. So depending on where you're practicing, you can choose Canada, and it'll show what guidelines are available in Canada for physical activity, oral health, whatever it be. And then it has systematic reviews, and going down to the primary research, RCTs, and even has some educational information like videos that would be related to the topic. So I find it very comprehensive in that way. It's like a Google for all your research questions. And yeah, that's why I find it very useful, that it just outlines all of the research that you're looking for based on your search terms.
Great, thank you. Yeah, another really good database to be familiar with. So I'm just seeing a question about health evidence. Does health evidence include gray literature as well? So the focus for health evidence is systematic reviews only, so that would include meta-analyses as well, reviews of reviews, but it's only that review level evidence. So you're unlikely to find a true systematic review in gray literature, so it's primarily, I would say perhaps almost exclusively, focused on the published research literature, because that's where you will find systematic reviews. And that's on purpose, because there is a definite benefit to honing in on those most synthesized sources of evidence where someone else has done the work for you into a systematic review. So making those available is what health evidence focuses on. Now, another source of information that can support your learning and capacity building is these understanding research evidence videos. And again, this was something that Grace talked about last night, but as I said, Grace is not able to join us today, so I'll just talk about these and introduce them a little bit. So these are short videos. They're actually YouTube, so you can find them on our website or through YouTube. So they're like maybe 5-6 minutes each. Plain language. They use cartoons to describe a particular public health application of a certain concept in research evidence. And the real purpose of these is that when people are engaging with the published research literature, sometimes they're coming up against terms that are not familiar to them, or they heard about it one time, but their stats course has been a long time ago, and they're a little bit rusty. So within 5 or 6 minutes, by watching one of these videos, you can get real-time information about what a certain term means that will help you to understand that research evidence that you're reading. So concepts like a confidence interval, an odds ratio, what is relative risk, what's a forest plot, concepts like number needed to treat. All of these have a video, and there are others besides, that really are intended to support people who are engaging with research literature but want to be sure that they're understanding some of those concepts. And not just understanding them in kind of an academic sense, but really understanding how they apply within a public health context. So that's why the cartoons, the plain language, the public health example. So you can see on this slide we have a cartoon example of vaccination, and this is about what's the effectiveness of vaccine and how do we understand that through a confidence interval. So suggest that you check those out if there's ever some terminology that you're not sure about. But the other thing that I would suggest for you is that sometimes people with Masters of Public Health or other related fields, when you're in the workplace, you're seen as a resource to explain some of this to other people who maybe don't have that background that you have. And it's one thing to understand a confidence interval yourself, but it's another thing to actually be able to explain that in plain language so that someone else will understand it and be able to apply that in a context that makes sense for them. So even if you feel like most of these terms would be familiar to you, maybe you use them all the time, if you're acting as a resource person within your team or within your workplace, it can be helpful not only just to be able to know it yourself, but to know how to explain it to other people. And sometimes the best way of being a resource person is to direct people to resources that help them figure it out themselves, because that way you're building capacity within your colleagues and teammates. So if you know about these videos and someone says, oh, help me understand this confidence interval thing again, you may want to explain it to them, but you may also want to say, and there's this video that can help you to understand this if you need a refresher later on. So these can be helpful for you, but maybe also for the people that you're supporting or providing some coaching to. Now, another aspect of being able to understand and use research evidence is that critical appraisal, pretty important concept. And have no doubt there are methods and tools to support you in this regard. So different checklists and approaches, some of which can be found on our website and others that you can look up elsewhere. So I'll ask Alana just to comment on critical appraisal.
Thanks, Susan. Yeah, I wanted to talk about critical appraisal checklists to assess methodological quality. And I know a couple other panelists had mentioned the importance of methodological quality in evidence and really great places that you can find quality evidence. And assessing the quality of your research is just really essential, because whatever you're doing, whether it's conducting a study or a review or designing a program, and if it's for school or for work, it will only be as good as the evidence that you base it on. So there are a lot of great critical appraisal checklists out there that are available through the repository and just online. A couple suggestions is the AMSTAR 2 for systematic reviews, EPH-PP for quality or quantitative studies, and then the CASP tools, CASP, which have a number of different formats for different study designs. And another one that's kind of hard to find but is really great is the Downs and Black. And it can be used for all different study types, qualitative and quantitative. So I think that's a really great tool. And of course, people use a lot of things like Consort and Prisma, not to assess the quality, but to make sure that everything you need to have in there is in there. So when you're doing projects or you're writing research proposals, using a Prisma or a Consort to just basically check whether or not you hit every point, I can find really beneficial. And one tool that I really wanted to talk about is that I don't think gets enough attention is the METAQAT, METAQAT, which was developed by Public Health Ontario. It differs quite a bit from other tools because it's a lot more flexible versus a very structured checklist type design. And it makes you really think about everything that you're trying to assess. So relevancy, reliability, validity, and applicability. It also leads to more appropriate design-specific quality assessment tools, like the ones I mentioned before. So you would complete the METAQAT, and then if you wanted to go more specifically into that specific study and that research design, then it leads you to the appropriate tools. And it comes with a really, really great user guide, which a lot of things don't come with. So it sort of walks you through every step. And that's available on the Public Health Ontario website. But I think regardless of whatever tool you end up using, using a critical appraisal tool is really important to making sure that you've got good quality evidence to inform whatever it is you're doing. And it's also really useful in the workplace when you have to justify why some evidence is more compelling than others. So I would really encourage everyone to check out all those critical appraisal tools.
Yeah, great point for sure, Alana, that, you know, as we're talking about these checklists, and there are all sorts of different ones, the critical point is to do a critical appraisal. You know, and the specific checklist will depend on what kind of evidence you're assessing. Is it a guideline? Is it a systematic review? Is it a qualitative study? You know, different tools for different uses. But you know, to have something that you like, that you are familiar with, that will help you to do that appraisal is the critical thing. So I'm seeing people asking about which tools are mentioned. So some of them are on the slide. You also mentioned the Medicat, which is listed under chat, and the Downs and Black tool. The link is there under chat as well. So those are available there. And so to go back to the, I'll just click back here as well for the videos. People were saying, someone was asking, what's the YouTube channel? If you search NCCMT, you will find all of those videos on YouTube, but they are also available through our website. Now, one other resource that I want to bring to your attention is the Rapid Review Guidebook. So once you've found all this evidence and you're trying to pull that together and make a decision or support someone else to make a decision, the rapid review process is really designed to help you to synthesize in a way that isn't going to be your life's work, you know, so that you can kind of get on with it and make the decision that you need to make. So again, that efficiency idea. This guidebook, which is available through our website, will help you to be sure that you're following all the steps that you need to do. There's some fairly technical information there about how to extract data from each of the sources that you've found in a way that is fair, unbiased, brings the same information in the same way from each source, and so on. So lots of good information here about the steps to conduct a rapid review. And this is helpful in a couple of ways. First of all, it is a process that's been figured out for you. So, you know, why not use a process that's already laid out and is based on evidence about how to do a good rapid review. And the other thing is that if you're needing to assure people or defend the process that you've used, it's good to have something beyond just, oh, well, I thought it up, or, you know, this seemed like a good way of doing it, to have some backup in terms of this was the process that I followed, this is what I included, this is what I left out for time reasons. And, you know, all of that is fine as long as you have a rationale for it. So the Rapid Review Guidebook really can be a great resource as you're trying to synthesize lots of different sources. And then one final resource that I will bring to your attention, and then we will have comments and questions. So if you have any questions, please you can start posting them now in chat. You know, people say, okay, wow, like all these resources, and they look around on the website and there's lots there, but like where should I start? Where should I focus? What's going to really be most helpful to me? One thing that we have on the website under capacity development is called the Core Competency Tool, and it is a way of organizing NCCMT resources, organizing them by the Public Health Agency of Canada core competencies. So you probably are aware that the Public Health Agency of Canada has laid out certain competencies that professionals working in public health should have. And we have resources that can support people to build skills in most of those areas. So the core competency tool will help you by giving you a chance to do a self-assessment, asking you some questions, it comes back with a tailored assessment of where you're strong and where you could still build your competencies, and will suggest resources, tools, modules, and so on that can actually help you to do that. So it draws on some of those resources that we've already talked about in this webinar, but they're organized in a way that is tailored to you if you do that self-assessment. So this can be a helpful way of figuring out where you want to spend your limited time so that you're focusing on things that are going to really build competencies in areas that maybe you haven't had a chance to really focus on. So given all that, we've thrown a lot your way in terms of resources. If there are questions, comments, anything else that you're wondering about, we're happy to take those questions. So feel free to post anything in chat now. I do want to thank our presenters for bringing those perspectives, and I think it's always really great to hear from people in the different lines of work that they're doing and how evidence-informed decision-making maybe looks different from one place to another. But those core skills and core capacities are the same. So, and as I said, our focus here is on building skills for people in the workplace. So, if you are looking for work or you're going to be, to have those skills that really help you to contribute to an evidence-informed approach within your team, your workplace, or to really show that in the academic work that you're doing. It's great for you, and it's great for the public health field to have more people who have some familiarity with these skills. Je veux dire aussi, je vois que nous avons des gens qui viennent de Montréal et autre part. La plupart de nos ressources du CCNMO sont disponibles en français et en anglais. Pas les tous, mais la plupart. Alors, je vous dirige vers notre site web en français. Any questions or comments that people would like to make or bring forward? We did have a question last night about whether there are resources for qualitative research, and yes, there are. There's a module, an online learning module about critically appraising qualitative studies, so certainly would draw your attention to that. The other question that we had last night was whether any of these tools will help people to navigate the kind of career path that would be most appropriate for them. And one of the things that I suggested was actually to look at, I'm going backwards here, to look at the core competencies and really get a sense of what you enjoy doing, what you like to do within those core competencies. And perhaps this will be revealing in terms of the kind of career path that will be most rewarding for you. So although our resources are not specifically tied to that sort of career guidance approach, I think they could be used to give you a breadth of the kind of competencies that different people working in public health will have, and some of those may be more to your liking than others. So certainly suggest that as a possible approach. So I don't know that I'm seeing a lot of questions here. Let me just look in the Q&A. Oh, the last two links don't work. I'll get Kate, who's helping us out here, just to check on the links there. What is the best way to choose a tool for implementation in the field? What I would suggest is if you're looking up a tool on the registry, which will give you a lot of information about the tool, as well as a link to the actual tool or framework itself, read the description on the registry, because it will tell you who it's made for, whether it's been evaluated, how it might be most useful in public health. So you can search within the registry to kind of narrow down to the few tools that are in the area that you're looking for. And then by reading the summaries that we've written at NCCMT, you can pretty quickly get a sense of which tool would be the most appropriate for your setting. So hopefully that will be helpful. The link for the qualitative tool, so CASP, which is a set of critical appraisal tools, all described in the registry as well as on their own website, has one for critical appraisal of qualitative studies. And the MediCat tool also incorporates qualitative appraisal of qualitative studies as well. So with that, thank you so much for your participation. When you close out today, you will see a survey, and we encourage you to give us that feedback. We do use it to improve for next time. And if you want more information about any of these tools, you have other questions, please be in touch with us. Our contact information is there. We're a very small place, so don't feel like your email is going to get lost. We will respond if you mentioned that you were on this website for students or this webinar for students. They'll send the request to me or to the right person to answer. So our job is to build capacity for evidence-informed decision-making. So if we can help you with that, be in touch with us. We will be happy to learn about your experiences using some of these tools, problems or questions that you might have. Is there something about this? I'm sure someone's done this, but I just can't find it. Please let us know what you're looking for, and we will do our best to assist you. I want to say thank you again to our presenters. Just fantastic to hear your perspectives. I hope everyone on the webinar found that to be useful. I'm sure that you did. And I want to wish you all a very pleasant afternoon and happy evidence-informed decision-making.